So I've trained, I think, 2 or 3 fellows a year for 17 years, and it's actually really nice for me to see where they end up. I have some who said, oh, Dr. Goldstein, I'm just going to do private practice, I just want to learn a little bit, and they're still ending up doing uveitis. And then I have a lot of fellows who are now heading academic uveitis services all over the world. I guess the first thing is that I have a great, huge patient population. You can't train people by reading them chapters. The only way that I learn, and the only way I think that you learn in a meaningful way, is by seeing patients. So I have a very, very high volume practice, which I think adds to what the fellowship has to offer. And I think you really have to have the time and the desire to give of yourself to really train somebody. We can talk about numbers, and my fellowship is one of the few surgical uveitis fellowships, which I think is a little bonus, but surgery is never a huge part of uveitis. I think the big thing is learning to be a clinician, learning to read the literature critically, which is something that we do together with our fellows. So we do clinical research projects, either retrospective or prospective, but one of the things I think to learn if you're going to be an academic physician is how to ask a question and how to design a reasonable way to get the answer. So that's also, I think, critical for a fellowship. I love training residents and fellows. I get a lot out of it. And it's not just that I get to see where they go when they grow up, which is part of it. I think that we keep ourselves educated when we have residents and fellows.